Hi, and thanks for joining us for this edition of CPSB-TV's Teen Talk, a one-on-one interview showed by teens and for teens. I'm Jaleaha Joseph, and in this episode, we are talking about a second school year deeply impacted by COVID. It's a virus that has changed the way we attend school and even interact with our peers. Our special guest to talk about all things COVID is Dr. Tim Haman. He is the Chief Medical Officer for CHRISTUS Ochsner in Lake Charles. Welcome, Dr. Haman. How are you today?
Great. Thank you for inviting me.
I know you are busy. We really appreciate you coming out here today.
Sure. Happy to do it.
Let's get things started by talking about this latest wave of COVID and the Delta variant. Can you tell us what's different about the infections now compared to a year ago?
Sure. So the Delta variant has produced a definite increase in the number of cases, especially in our area. In terms of hospitalizations, we've seen far more hospitalizations in this wave than we have in any of the previous waves. It does seem to be impacting younger people than we had previously seen. When this first started, we were seeing patients in their 70s and 80s, and right now we're seeing people as young as their 20s and 30s in the hospital. So we have seen, not at our hospital, but I know at other hospitals in the region, we've even seen some pediatric cases have to be hospitalized.
We know there is a vaccine available now for people ages 12 and older. What are your thoughts on teens and the vaccine?
I think it can be helpful. There is good evidence in kids as young as 12, and it's actually being studied down to 5-year-olds right now. For the most part, teenagers are not going to have a severe outcome from COVID. I think it's important to understand that. I don't want to sit here and say that every teenager who gets COVID is going to end up in the hospital or have a mortality. But, there are other things that can happen. There can be lung damage, heart damage, strokes, blood clots, all those sort of things, and it's important to try and prevent those. And then the other issue is, a lot of us have grandparents, parents that we might also expose, and so it's important to help reduce that risk as well.
Would you say the vaccine is effective even though people who have been vaccinated can still contract COVID?
Yes, so there has been definitely a little bit of a decreased efficacy with the Delta variant as opposed to the original strain of COVID, but it is still 60 to 70% effective in preventing infection in total, but it's also greater than 90% effective in preventing severe disease and hospitalization, which is what is really important.
What are the main side effects of the vaccine?
So with the COVID vaccine, kind of like a lot of vaccines, the main side effects are fever, muscle aches, and fatigue. There are very rare cases of things like blood clots and myocarditis, which is inflammation around the heart. But the incidence of blood clots and myocarditis is actually much higher in COVID than with the vaccine. So it does reduce the risk of those sort of issues.
With the different vaccines, how come the Johnson & Johnson is only one shot while others are two?
It just has to do with the way that the vaccines were created. The mRNA vaccines, so the Moderna and the Pfizer vaccines, are newer technology, and so they require the 2-shot booster series, and there's actually some studies going on right now with the Johnson & Johnson about making it a 2-shot series as well to try and increase the benefit, because we are seeing with time that the antibody protection does go down, and so it does look like for maybe all the vaccines there will be some boosters needed.
There have been videos and social media messages related to concerns about the vaccine causing infertility in women. Is there research to show that's valid?
No, I'm not sure where all that started, but there has definitely been a lot of study around that, because that's a concern, is women and then pregnant women, and so there's clear evidence that it does not have any impact on fertility. It doesn't have any impact on pregnancy. In fact, the National Society for OBGYNs recommends that women of childbearing age and pregnant women get vaccinated, because there have definitely been cases, even here in our local community, of pregnant women that have had severe episodes of COVID. And so there was a study that just came out yesterday showing that there was no impact in terms of bad outcomes from getting vaccinated while pregnant.
What are your thoughts on mandating masks?
I think in places where there are a lot of people in close quarters, it can help if they're worn properly to help prevent transmission, because what we're trying to do is slow down the spread of respiratory droplets, and that's what masks are really good for. We're not going to stop tiny little virus particles, but most viruses are not floating free in the air. They're found in respiratory secretions and in droplets, and that's what we're trying to slow down.
Can you demonstrate on how to properly wear a mask for us?
Sure. So the most important part is to cover both the nose and the mouth. You know, you see a lot of people in the grocery store and in other places where it's down around their chin or something like that. But the most important thing is to cover the nose and mouth, and then make sure that it's somewhat tight around the sides of your mouth, because you don't want a lot of things to escape. And so, you know, you can see it's kind of flush with the sides of my face here. It's over my nose and kind of covering there, and then it's also, there's not a lot of gap here. So what you don't want is a lot of gaps around the sides that would allow airflow.
So you just want to close in on...
Right. And the best sort of mask is something like an N95. We use those in the hospital when we're dealing with COVID patients, and those create a complete seal all the way around your mouth.
When do you think we will come to see a normal, meaning like no mask mandates and stuff?
I'm optimistic that things are getting better. I think that we are hopefully at least in a plateau, if not on the back end of our current wave with this Delta variant. And I think that between the number of people who have been vaccinated in our state and in our region, and then the number of people that have had COVID previously and have some degree of immunity from that, that hopefully we're getting to the point where we'll see that the spread has slowed down. But I do think within the next couple of months, we will hopefully see a return to how things were maybe in June, when things had felt like they were almost back to normal.
How can we function moving forward if the virus continues to mutate?
I think kind of what I mentioned earlier, where you get to a certain point where you've got enough of the population vaccinated and then enough of the population that has immunity from prior infection that you just run out of hosts for the virus. And so that's why it is important that we try and get as many people vaccinated as we can, because that's how the virus mutates, is through people that it infects and replicates. And so what we want to do is reduce the number of people that it can infect.
What are your thoughts on some colleges, workplaces, and even restaurants requiring a proof of vaccination to be there?
That's probably more of a political question than a medical question. I understand the thought behind it, but I do think that there is a little bit of concern about that, especially knowing that that vaccinated people can still spread infection with the Delta variant. So I don't know that makes sense for the long term.
I can't imagine how exhausted you must be and other healthcare workers. What has the past year and a half been like?
It's been a struggle. I think the hardest part has been, especially with this latest wave, was kind of, I think like everybody else, we thought things were getting back to normal. I felt like May, June, cases had gone down. We were down to maybe 1 or 2 patients in the hospital. I thought, this is it, we're done, we're getting back to normal, and then, we've kind of gotten hit harder than ever. And so that's been the frustrating part. But I think the thing is, this is what we're here for, this is what we do. We've done this with other pandemics in the past, and we'll continue to do whatever we can for the public. But to be honest, I feel bad for you guys. I mean, this is your 3rd year of school now that's been impacted, because you had 2020 where school just basically got the end of the 20 school year where things got canceled, and then you had all year last year dealing with this, and then now again. So I can't imagine having 3 years of high school that are impacted by this. So I feel for you guys.
If a teen watching today were to only have one takeaway from all of this, what's most important for you to communicate?
I think the most important thing is that the vaccines that we have are safe and effective, and they're going to be the best tool we have to really kind of get this pandemic over with. Mm-hmm. And I think the other thing is, if they have questions, the most important person they can talk to is their doctor.
That was great information, and I would just thank you. I thank you for coming out here today. I know you've been working hard. So thank you for taking the time to come with us today.
Sure, absolutely. Thank you for the invitation.
And thank you for watching this edition of Teen Talk. We'll see you next time.